So my name is Tong, and this is Jaylene, and we're both students from South University. And today we're going to present to you on complex regional pain syndrome, also stands for CRPS, which is right. Yeah. So basically, what it is a painful, disabling, and chronic condition. Affects like 50,000 people every year. And it was formerly known as Reflex Sympathetic Dystrophy, or RSD. And they just switched to CRPS recently. And the demographics, so basically it can happen at any age, but typically it's more common in women, and the peak is usually 40 years old, and it rarely occurs in the elderly population. Right? So there are 3 classifications of complex regional pain syndrome. The first one is gonna be type 1, and this develops after a nauseous event. And then you're gonna have spontaneous pain, allodynia, and you guys happen to know what that means. So basically allodynia, you have pain, or you experience pain from something that normally doesn't cause pain. So like, I come up and touch you on the shoulder, you have pain from that, like intense pain, for example. And then the last symptoms of type 1 is going to be edema, some vascular abnormalities. So you're going to have a problem with circulations. It's going to cause you to swell up, which is what edema stands for, or is. Type 2, it develops after a nerve injury. So anytime, say you have a herniated disc, that's a nerve injury. You guys know what herniated disc is? Okay. That's when you have a bulge in your spine, typically in the lumbar area, your lower back. And that kind of injury can cause you to have type 2 CRPS, and then you're gonna get some swelling as well, abnormal circulation. And then the last classification would be NOS, or not otherwise specified, and this is the type of injury that isn't certain to be the cause for the symptoms. So if you go to a doctor's office and you tell them you have pain, but they will know if that pain is causing your symptoms, which relates to CRPS. I'm sure that makes sense. But it's just not specific. Like, they can't pinpoint exactly if this is the reason why you're having complex pain syndrome. Right? Your signs and symptoms, obviously gonna be pain. That's like the most prominent symptoms of this syndrome. Sensory abnormalities, burning pain. Like if you have pain in your shoulder joint or your hips, it's gonna have that burning sensation. And then allodynia, which I've already discussed earlier, you're gonna have pain from a non-painful stimulus. Then impaired motor functions, so like your balance is off, your coordination, everything is like backbeat. And then emotional, psychological response. So this is a big thing, because if you have pain or you're always in pain, you're gonna be more apprehensive or like anxious, stressed all the time, and it's just gonna cause like a bigger problem to an already existing symptom. The cause for the symptoms, it's uncertain, but over the past few years, they discovered that people, healthy people, whenever they undergo an injury, they have this thing called inflammation process. So if you cut yourself, that wound is gonna get red, swollen. It's like a regular process so that your skin repairs itself. And the inflammation process goes away after that, so that your wound is repaired and goes back to normal. But in people with CRPS, their inflammation process lasts forever. So that wound, like, it doesn't heal, it just keeps inflaming, or it's hot, it's red. And it's because it's due to the lack of anti-inflammatory mediators, so they don't have that mediators to offset or turn off their inflammation process. So they're just gonna have pain indefinitely. And these are the pictures of what atypical CRPS patients have on a daily basis. can see this side is affected, it's swollen, it's hot, it's burning. It's like, and this is a normal side.
Yeah.
Down here it's red, her hand. Sometimes you have shaking feelings and your grip strength, sometimes the motor or the strength in your fingers diminish. And over here, that's typically the
area
location.
where you feel pain. And another thing, there's this thing called pitting edema. So let's say in the picture with the foot, if you push down on the left foot and you take your finger off, there's still going to be an indentation of where you push down. So that's called pitting edema.
Yeah. In normal people, if you push down the skin, it should resurface quickly. But in people, like, it's gonna leave like a hole or
like an indentation.
Yeah.
Right. So the treatment for CRPS, there's no real gold standard for it because it's so indefinite for the symptoms. But one thing you can do is physical therapy. The goals for physical therapy is to minimize edema and pain, desensitizing painful extremities, promoting normal positioning, and decreasing muscle guarding. So people with CRPS, they often, because they're so apprehensive, they're so often to basically tense up and be like guarded of their pain because of what they're going through. And patient education is also important, so exposing patients to painful activities and situations in hope of decreasing their anxiety levels. So basically exposing them to physical therapy and normal daily activities will help decrease their anxiety level, and teaching interventions that deals with variable vasomotor responses. So basically when to ice, when to use cold, and when to do gentle exercises. Now, managing CRPS in the chronic stage, there's really nothing you can do but just to manage the pain. And one thing you can do is mirror therapy. Have you guys heard of mirror therapy? So basically what it is if you take a mirror, and let's say I want to do it for my lower extremities, and my right leg is affected, I could put a long mirror in the middle of my body and have the reflective side on the affected side. And what this does is it tricks your brain into thinking that you can see your reflection of your left leg, and it'll help decrease the pain of the leg that isn't seen in the mirror. So let's say you lift your right leg, it'll make your brain think that your left leg is also moving because of reflection of your right leg. So it's kind of, you have to like really see it to visualize it, but it'll help with something that's called phantom pain. That's your brain thinking that you're still having pain in the part of your leg that's like not really receiving any stimulus, basically. And modalities is basically heat, ice, e-stim, electrostimulation, things like that. You can use that to help with managing pain and increasing mobility of involved tissues. So basically joint soft tissue mobilization, which can be like massaging out the muscle and basically releasing any tension in your muscles. And passive and self-stretching techniques. So passive stretching is when someone does the stretching for you, and self-stretching is like you like stretching yourself and using assistive devices like a stretch strap to help you stretch anything. And improving fundamental performances, so carefully monitoring and progress strength, endurance, and functional exercises. And then this is a video of someone with CRPS. I don't think the sound's going through the TV. No, it's not. So I'll just stand here and show you guys. Yeah, so that's just a video of someone that had a flare-up of their CRPS, and it can progress for hours. It just depends on how the flare-up's gonna be for the patient.
Alright. Do you guys have any questions to conclude the
And these
presentation?
are handouts of CRPS, basically what it is, and if it's like hereditary, and
Yeah, that was my first question. Is it like a hereditary thing, or is this just like happen?
They're not really sure, it just happens out of nowhere, like the diagnosis, there's no way to diagnose this treatment, it just happens.
yeah, and
But
it
it's
can
it's more common in women.
and it can happen from traumatic instances, like a bad car accident or falling off of a ladder, something like that. There's really no telling where you can get it from. It just comes
Yeah.
out of nowhere.
Yeah, that's why it has the word complex, is this name, it's so complex and nobody can really pinpoint the exact cause. Yeah.
So like the injury that will most likely cause like CRPS, like a car accident or like
Like a
fall off
nerve,
ladder,
anything that
How-
involves your nerve.
like
How
how
does it?
close to like how far away from that like experience would you start experiencing symptoms? Like does it have to be like within close proximity? You guys said like 40-year-old women like experience it mostly. So would the car accident be something that happened like around that time, or would it be something from like a past injury, or like something that happened maybe years before that is just now like becoming a problem, or is it something that like happens and then a couple weeks after you heal you realize you're not really healing?
Right. It really didn't say much about that because they can't necessarily tell you a time frame, like, oh, your car accident was this date and a week later you're gonna have CRPS. It just depends on basically when it wants to come.
Yeah, like
Yeah.
but after your car accident, you're gonna undergo like an expected amount of time to heal. So if you hurt your neck, like within a year, you should feel better. But if you still feel pain after a year, then that's what CRPS typically will manifest.
Yeah.
After a normal healing time, if you're still not healed, then that's something wrong.
Yeah,
with
then
your
you
body.
go and like get tested and diagnostic testing, and then that's when they can tell you whether you have CRPS or something different.
Thank you.
Mhm.
Any other questions?
Well, I mean, it seems a little scary, but
Yeah.
what
It's rare. That's good though.
Yeah.
Not a lot of cases, but still something to know and to watch out for.
But
Appreciate
we're
it.
done.